ang topic natin ay scoliosis. Pagka sinabi pong scoliosis, ibig sabihin po nito, may curvature sa spine. Common po ito sa mga growing years ng mga bata between 10 to 15 years old. Alright? 10 to 15 years old. Pagka sinabing scoliosis, minimeasure po ito through x-ray. Beyond 10 degrees, diagnosis na po yun ng scoliosis. After 10 degrees, ibig sabihin may scoliosis na yan. Ano nga ba ang mga dahilan kung bakit tayo nagkakaroon ng scoliosis? Okay? Ang mga dahilan po kung bakit tayo nagkakaroon ng scoliosis, madami po ito. May mga theories po na binigay ang mga expert. Okay? Ang pasyenteng may scoliosis, pwede siyang genetics, nagkaroon ng problema. It could be a neuromuscular scoliosis. Another one is congenital scoliosis. Another theory is an adult scoliosis, nagkaroon ng degenerative changes, nagkaroon ng disc herniation, so nagkaroon ng postural scoliosis. Pero, ang pinaka-common, 80% ng mga pasyenteng may scoliosis is what we called idiopathic. Ibig sabihin, hindi natin alam. It's unknown. Hindi natin alam. It's unknown na bakit nagkakaroon ng scoliosis ang pasyente. So, ngayon, hindi pa rin. Hindi natin malaman kung bakit nagkakaroon ng scoliosis ang tao. But 10 to 15 years old, very common siya. Ang treatment sa pasyenteng may scoliosis, kailangan maagapan. Lalo na yung mga growing years, between 10 to 15. Kailangan malaman yung degrees ng curvature. May tinatawag na C-curve and S-curve. Ito po yung spine natin. Pagka ganyan ang curve ng pasyente, ito ang tinatawag na C-curve. Yan, naka-letter C. Pero the other type of scoliosis is mayroong tinatawag na S-curve. So, ibig sabihin, yan, gawin natin yung spine na to. Ibig sabihin, naka-S yung shape ng curve. Yan, makikita to sa x-ray. Etong mga S-curve na to, mapapansin nyo, symmetric pa rin yung shoulder. Pero may pain siya sa lower back pain. So, I would say 30% ng mga pasyente may scoliosis may low back pain. Again, may C-curve and S-curve. Pagka sinabing C-curve, hindi na siya pantay. So, magkakaroon ng asymmetry. Ibig sabihin, mataas yung right shoulder or mataas yung left shoulder. Okay? Yan po yung explanation kung bakit po may scoliosis ang tao. 80% of the time, we still don't know. Okay? Tapos pagka umidad na, as we get older, nagkakaroon na tayo ng tinatawag na degenerative scoliosis o naging habitual. Kung may degenerative disc condition o masakit yung left side natin, magtitilt tayo sa right side. Yan po ang mga dahilan kung bakit tayo nagkaka-scoliosis. Okay? Magagawa po tayo ng mga exercise na pwede ko ipakita sa inyo. Most of the time, pagka ang pasyente ko may scoliosis dito sa clinic ko, pagka may scoliosis yung pasyente, may tightness siya, may tightness sa hamstring muscles. Ayan. So, number one, i-stretch natin yung hamstring ng pasyente o i-stretch natin yung hamstring muscles natin. Alright, number one exercise, stretching po tayo. Gamit tayo ng rope or kahit na anong long belt, yung mga ganyan, so stretch natin yung hamstring. Ang gagawin po natin, 10 repetitions and hold it for 15 seconds, yung hamstring stretch mo. Hamstring stretch po natin. Okay, umpisa na tayo. Yan. So, gagamitin nyo yung belt. Tapos, siga tayo. And then, make sure you stretch your hamstring. Hold it for 10 seconds. If you can hold it for 30 seconds, 10 repetitions, that's even better. Okay? Hold it for 10 seconds and you do it for 10 repetitions. Again. Yan. Medyo tight nga yung hamstring muscles ko. Yan. 10 repetitions and hold it for 10 seconds. If you can go as far as 30 seconds, that's okay. That's even better. Alright? Now, gawin natin sa kabila. Yan, stretch natin. Hamstring muscles. Hold it for 10 seconds. You do it for 10 to 30 seconds. And do it for 10 repetitions. Okay, good. Last one. Yan. Okay. So, sa both sides, sa left side, you do it 10 repetitions. Hold it for 10 seconds. 10 to 30 seconds. It depends on your tolerance, okay? Now, sa right side, ganun din po. 10 repetitions. Hold it for 10 seconds. 10 to 30 seconds. Number 2 exercise, gagawin po natin yung prayers position. Ang prayers position, pakita ko sa inyo. Prayers position para nagdadasal. Ganyan. So, pagka sinabing scoliosis, since na hindi ko kayo nakikita, hindi ko pa kayo nadadiagnose, gagawin nyo to sa tight. Let's just say right side is tight or left side is tight. Okay, ulitin ko. Guys, pagka scoliosis kasi hindi ko kayo nakikita, kailangan may physical therapist na magda-diagnose sa inyo. So, yung i-stretch nyo, yung tight muscles. Let's say may tightness kayo sa right side, i-stretch nyo yung right side. Alright? So let's say ito yung tight po. Tight yung muscle dito kasi ang pasyente nakaganito. Yan. Tight yung right side. Ito po yung tightness. So ang gagawin nyo, i-stretch nyo away from the tightness. Nakikita nyo? Yan, i-stretch natin. Ulit. If you have tightness dito sa right side, mag-move away from the tight area. Yan po ang tinatawag na scoliosis exercise. Away from the tight area. Alright? Ito po. Okay. Nakuha nyo na yung ibig ko sabihin. Prayers position again. Alright? Like this. This one, hold it for 30 seconds. And then, move your hand. Kung may tightness kayo sa right side, stretch nyo yung right. Mag-move kayo all the way to the left. Punta kayo sa kaliwa. Like that. Hold it for 30 seconds, and you do it for 3 sets of 10. And then back to neutral. Okay, and then move to your left. Stretch your right side. Hold it for 30 seconds. And then back. And last one, papakita ko sa inyo. Last one, pagka may tightness sa right, move to the left. Okay, now if you have tightness on the left side, pagka ang left side niyo is tight, you have to move to your right. Igalaw niyo yung arm niyo, mag-move kayo to the right, i-stretch niyo yung left side. Again, 3 sets of 3 times, and you hold it for 30 seconds. And then back to neutral. And then stretch, go to the right kung tight yung left nyo. Hold it for 30 seconds, and you do it 3 repetitions. Right? So yan po yung prayers position. Pwede nyo gawin din ito in sitting position. Again, depende po sa tightness yan. Hindi ko kayo nakikita, kaya kailangan makita ka ng physical therapist, identify which side, kung tight yun dito nyo or your left side. So if you have tightness on the right side, move the opposite way. If you have tightness here, you go move the opposite way, to the right. If you have tightness on the left, you move to the right. If you have tightness on the right, you move to the left. Okay? Naintindihan nyo? Alright, in sitting position, pwede nyo rin gawin yung scoliosis exercise. Itatouch nyo lang po yung ground. And then, kung may tightness kayo sa right side, move to the left. Hold it for 30 seconds. And then back to neutral. Pagka may tightness sa left, you go to the right. And then back to neutral. Yan po. Alright, dalawang exercise na yan. Now, Again, yung scoliosis is tightness going this way to the right side or to the left side, depende sa diagnosis nyo. Number 3 exercise is what we call side stretch. Okay, ang scoliosis ko is this way. So, scoliosis ko is nasa left side. So, kailangan ko i-stretch to. Alright, dito, papakita ko sa inyo. So, ang scoliosis ko is sa left side, kailangan ang elbow ko nandito. So, nakita nyo, i-stretch ko yung left side ko. Alright, ganyan. And you hold this for 30 seconds. Hold it for 30 seconds and 3 repetitions. And then back to neutral. And then stretch it again for 30 seconds. Yan. Tapos, kung kaya nyo na, extend yung elbow nyo. And make sure hindi nyo ginagalaw yung pelvis nyo, ha? Nandito sa plinth o nasa table yung pelvis nyo. I'm not moving my pelvis. I'm staying in one way. So, nakikita nyo? I let the gravity yung gumagawa ng stretching. Yan. Yung tightness of the left side. Okay. Kung ito naman yung tight, let's just say tight yung ganito. Alright? Kanina, ang winork natin is the left side. So, tight yung right side. May scoliosis kayo sa right side. Ang gagawin nyo is the same way. 30 seconds, 3 repetitions. 30 seconds, 3 repetitions. And then back, extension. 30 seconds, let this stretch. 3 repetitions. 30 seconds, 3 repetitions. Right. Good. So guys, yan po yung mga stretching exercise para sa scoliosis. So I don't know which side yung may tightness sa inyo. You have to see a physical therapist or a doctor. Alright, number 4 exercise. This is what we call cat and camel exercise. Number 4 exercise, cat camel. Alright, so the cat part, you're gonna do this, you hold this for 5 seconds. And you do this for 30 repetitions. 5 seconds. And then camel, 5 seconds. Okay, yung head nyo naka neutral position, slightly extended, and then back. 3 sets of 10, hold it for 5 seconds. Okay, like that. Yan po yung cat and camel exercise. So 5 seconds, hold. And then you do it for 3 sets of 10. All right. So standing exercise. We're gonna do standing exercise or standing stretching the opposite side. Again, kung may tightness dito, okay? Kung may tightness, yung scoliosis yun nandito, you're gonna do stretching just like this. Hold this for 30 seconds. And just do this for 3 repetitions. Okay. Now, if you have tightness around here, you go "30 seconds, and then back. 30 seconds, and then back. And then 30 seconds, and then back. So 3 3 repetitions, hold it for 30 seconds. All right. Now, we're gonna do strengthening exercise. After all those stretching, you need to strengthen the muscles. So we need to work on that core muscles, your abdominal muscles, and then the lower back. Pagka sinabi natin core, it's not just the abdominal muscles, it's also the lower back area. Okay? Nandito na po tayo sa strengthening exercise. So we're gonna do all fours position. Alright, all fours position again. And then you lift your right arm and then your left leg. And make sure you tighten your stomach muscles or your core muscles. Hold it for 5 seconds and you do this for 10 repetitions. Okay, just like that. Back. Alright? Okay, back. Last one. 5 seconds hold, 10 repetitions. And then back. Alright? Another one. The progression nito is what we call the Superman. Right? The Superman would be the same thing, but you're lying down. And then back. Hold it for 5 seconds. Kala nyo it looks easy, but this one is very hard. Okay? 5 seconds hold. 10 repetitions. Back. 5 seconds hold. 10 repetitions. Okay? Alright. Yung po yung mga strengthening exercise. So you're doing all fours position. It looks easy, but it's actually very hard. Alright? Another one is I'm going to show you last exercise is the bridging exercise. This is the last one. Very effective po ito sa mga pasyenteng may scoliosis. Lalo na yung mga, if you have yung mga anak nyo 10 to 15 years old, kailangan ma-identify nyo agad yung scoliosis. Kasi pagka naapektuhan yung 10 years old, nagpo-progress po siya. Pagka nag-progress, magkakaroon siya ng, pwedeng magkaroon ng complication, magko-compress yung lungs, yung heart, magkakaroon ng neurological problem. So make sure you identify, check, make sure you see your doctor, and then do an x-ray para ma-measure yung scoliosis. Okay? Last exercise is what we call bridging. And bridging exercise. So I'm going to show you. You don't need the pillow when you're doing bridging. Alright, so when you say bridging, you make sure your core muscles are tight and in neutral position. So you don't do quick movements like this, okay? And you don't tilt your pelvis. You have to identify the neutral position, tighten your stomach. Okay, just do quick exhale like this and make sure you tighten your stomach, okay? And then you lift your pelvis up, hold it for 5 seconds, and then bring it down slowly, just like that. Again, tighten your stomach, and then up, continue tighten your stomach, and then slowly relax. Tighten your stomach. Make sure you tighten this, okay? Make sure it's tight as you lift up your pelvis. Alright? Very effective po ito. Kasi you're strengthening your lower back, your glutes, and then your spine. Spinal muscles. And then back. Okay. Alright guys. Yan lang po yung mga exercise. Very effective. Doing all those scoliosis exercise. Very effective po siya sa mga pasyente ko. Pagka may mga tanong kayo, just message me. And, alright. Okay. So, yan lang po. Magbasa tayo ng comments dito. Okay. Topic lang po natin ngayon is scoliosis. Alright. Isang tanong lang. Alright, maghanap tayo ng magandang tanong. You can ask questions. Okay, ito si si Miss Rita Ritz. Hi Doc, anong exercise sa neck na nawala yung curve? Nag-straight yung x-ray na dapat curve ang neck natin. This is not scoliosis, this is probably cervical spine degenerative changes, nag-straighten yung cervical spine. Pagka sinabing na nawala yung curve ng neck, posible pong nagkaroon ng disc degenerative changes, nagkaroon ng arthritis, kaya po nawala yung curvature ng neck. Kailangan may cervical lordosis, normal yung cervical spine curvature. Alright. Okay guys, yun lang po yung mga exercise na pwede nyong gawin. Basic exercise na pwedeng gawin. Very effective po siya sa mga pasyenteng may scoliosis. Number 1, identify yung curvature, whether it's the left or the right. Pag alam nyo na yung may tightness, yun po, mas madaling magawa ang exercise. Okay? Alright, take care guys, and I'll talk to you soon. Thank you sa mga nag-subscribe sa YouTube. Please continue to subscribe sa Dr.Jun Reyes PT DPT for sa YouTube natin. And thank you sa mga nag-follow and nag-like po sa page natin. Alright, continue sharing our videos and take care guys and enjoy your week. Bye-bye.